So I had a blepharoplasty, as well as I had a facial lift. Well, a couple of things. One was that for my eyes, I was actually having some visual problems, and that I've got thinning on my optic nerve, and then the mapping on my eye is showing that I'm losing some peripheral vision. So one was really for medical purposes, in that the doctor took about 2 centimeters between the top, the lower, and upper lids, and to give me more peripheral, because I know that because of the thinning I'm going to lose a little bit, but I had some concerns, and so I did that. The other was I had lost 20 pounds for my daughter's wedding, and as you age, gravity is not your best friend. So for that reason, losing the 20 pounds, it became very apparent that the skin and the extra, even though I've always been fairly thin, it just wasn't, it's the first thing you look at in the mirror, so. The surgery itself, I knew absolutely nothing that went on, so they were, the doctors, the nurses, everybody here on the staff are incredible. All I remember is being here at 8 and waking up around 5 o'clock. So the surgery itself, I have no recall of anything. I would say probably the most difficult piece was the second day, and that has to do with the anesthesia. And but all in all, you know, in the next 2 weeks after, actually the next 3 weeks, the doctor saw me on a regular basis, like almost I saw him nine times in 4 weeks. So I felt like I got a lot of attention. They would check everything and make sure that I was recovering the best that I possibly could. Absolutely. I think there's 2 ways that you have to look at it. There are 3 stages in a surgery, in that there's a pre-op, there's actually surgery, and then there's a post-op. And the 2 things that I have controlled over was the pre and the post-op, and I wanted the very best doctor that I could. I did a lot of research online first before making the decision, and I looked at Dr. Reynolds' portfolio, I looked at his credentials, I looked at the fact that he was dual certified. Those were all important things. And so I don't think I would change anything. I think that I'm very realistic about the recovery process, that it takes about a year. So there's a little bit of tightening right now, a little bit of numbing, but that wasn't anything that I knew that I wasn't going to have to face. Last week I went back to my 40th class reunion, and I was told that it looked really good. So I did not go past that, but I appreciated the fact that they go, wow, you look really good. So I think I could give Dr. Reynolds a little credit for that. Yes, I've been really happy. I think that, again, it's a process that we'll see. I'm at 3 months right now, at 6 in a year. But the blepharoplasty, probably the fact that I don't have jaw lines, big eyes, and sort of the combination of how we're also treating it with a skin product also to tighten up everything so that I don't have to have additional surgery. What I did notice is that I think when you're young, you take for granted the fact that your skin doesn't age, and you get get a lot of sun exposure and things along those lines. And as you age, that's not necessarily the case. You sort of pay a price for that. So some of the discoloration, I see that fading. And it also, I think in combination with the surgery, is working really well. You know, just the fact that I think that people in general want to feel good about themselves. And so when it comes right down to it, when you feel, people say, wow, you look really good, I think that piece around self-esteem, that's really helpful. The intent was not to have the surgery for that reason. I feel that I'm 58, I'm not going to lie about that, and I told Dr. Reynolds when I had the surgery, I didn't want to look like I was 20, I didn't want to look like I was 30, I just wanted to look like a good 50. And knowing that that a lot of elective surgery, people choose in their 60s and 70s. My health is really good. I felt like it was the very best time to have it done. And hopefully that, I guess we'll see what will result, and look forward to that. As far as the staff, they are just probably, in my opinion, the very best. They're very professional, they're very caring. The fact that they know you by name, they want what's best for you. Like I said, it's the staff, the professionalism, how much they care, the fact that they could address every question over the course of that first month pre-op. I had sort of peace of mind. Oh, absolutely, and no doubt. So I know that this is a testimony, but the idea is that if you feel that you have the very best doctor as well as the staff taking care of you, why wouldn't you share that with them?